I have a very deep specialty interest in joint reconstruction, and I've become more interested and much more experienced in revision joint replacement, including the hip and the knee. Revision is what some people say redo surgery. It's interesting. The patients that have had hip and knee replacement in the 1970s and 1980s are now older in age, and they have had a long life, often with a great functioning joint replacement, but are back because there is some kind of failure, of mechanical failure of a joint replacement, whether it's of the hip or the knee. And there's a whole area of orthopedics devoted to how we can get these people back up on their feet and get them moving again with new joint replacements, or sometimes they're more complex procedures, and sometimes they can be pretty easy. It depends as to how long these joint replacements last. The very, very active individual who puts a lot of demands on a joint replacement is one that might not last as long. It might be a 10 or a 12-year run with a joint replacement. And someone that takes it very easy, or someone that is older at the time of their joint replacement, it could last 20 years without any problem at all. And many of our hip and knee replacements last 15 to 20 years very conservatively now. Robotics is one of many advancements in technology around hip and knee replacement right now. It's one that is very heavily marketed today, and it sounds good. It is a very effective tool for a very limited number of patients. There is still not a robot that can take the place of a thinking orthopedic surgeon that is the advocate for their patient. It's a wonderful technology, as was and still is computer navigation. There are some positives and some negatives, and those are the factors that we have to take into account when we're thinking about the effectiveness and the safety of these procedures as an advocate for our patients. For the last several years, I've been a director of the Joint Replacement Center at the Medical Center of Central Georgia, and in that role, it's been exciting to help the hospital and my fellow colleagues in orthopedic surgery develop processes that make patient care safer, make it more effective, make surgery less painful, and the overall experience better. There are a number of patients that avoid surgery because of the perception of pain, and I think that's a very legitimate perception in terms of what has gone on in the past. And to be sure, orthopedic surgery is not a pain-free venture. It's always going to be associated with some level of pain, but it's being managed today so much more effectively than it was even 5 years ago. We've teamed up with the anesthesia people at the hospital, and the anesthesiologists and the nurse anesthetists at the hospital, and as well at our surgery center, have done such a great job of doing regional anesthesia, or what we call nerve blocks, to help with pain management. And these nerve blocks can be effective for many hours after the surgery, and sometimes several days. And that helps to soften the landing, so to speak, after surgery. And I think it's been very effective in terms of people getting up and moving after hip and knee replacement and beginning their exercise program, and overall having a more satisfactory experience. There's a host of non-operative approaches with hip or knee arthritis and with shoulder problems as well. Today, there's a new lubricant material that is injected into joints, mainly the knee joint, but we also sometimes will use it for hip and shoulders. And this Hyalgan injection very closely mimics joint fluid itself, and it works as not only a lubricant but as a cushion for individuals that have advanced arthritis, and even those who have early arthritis can benefit from it if they fit the criteria. Effectiveness in surgery, safety in surgery, and the overall patient experience depends on education. And we seek to educate our patients as much as we can before surgery so that they really know what's going on. At the medical center, we've done a lot of work to develop a process where patients come before surgery to understand what it is that they're going to be going through and how they can participate in that more actively for a great outcome. If our patients understand the requirements that would increase the chance that they have a successful outcome, they may get back to work in half the time that somebody that doesn't understand these things. So we really have a big commitment to education, not only in terms of the satisfactory outcome of the surgery, but getting people back on their feet, more active, and back to work earlier. For me, what is really exciting is to see the patient that may not even be able to walk, but certainly has given up most of the physical activities in their life, and discuss with them and their family the options they have. And when they make the commitment to me and I make the commitment to this patient and their family around hip or knee replacement, that they come through it and have so much satisfaction in getting back to visiting with their family and doing for themselves what they have not been able to do for a long time. It's so satisfying to see an individual who has now, restored so much of their life. I mean, to me, it is really exciting. I have several patients in my practice that have been an inspiration to me, and the patient I can remember most of all is a woman about 68 years old who had been in a wheelchair for about 2 years, and with 2 hip replacements, she's out in the community and just has a great quality of life now, and that gives me a lot of satisfaction. That's what I'm passionate about.